Now, I would really like to know why it is that there's this disparity in treatment, except it makes our people, the BAME people, scared to seek healthcare. And so many of us are just stuck at home with symptoms, with pain, because we're afraid to go to our GP, because we're not being listened to.
Poor individuals often struggle to access healthcare because they lack the financial resources necessary to pay for medical service. On the other hand, wealthier individuals have the privilege of being able to afford private healthcare service, which can provide quicker access to medical treatment. In emergency medical situations, where immediate access to care can be a matter of life and death, wealthy patients may have easier access to urgent medical service, whereas poorer patients may be forced to use overcrowded public hospitals. It decreases overall state of health of the community. The poor are being neglected in the hospital even though having access to healthcare is a human right and must be for everybody. Giving equal access to healthcare promotes social harmony by decreasing wealth-based difference and encouraging a sense of unity and responsibility among all. Individuals that can access healthcare service, regardless of their financial condition, can result in a greater quality of life and a healthier, wider society. Providing equitable access to healthcare fosters social justice by ensuring that everyone, regardless of economic background, has the same possibility to live a wealthy life. This minimizes wealth-based inequities in health outcomes. Implement policy and programs that aims to achieve universal healthcare coverage. This ensures that everyone, regardless of their financial status, has an access to essential medical service. Develop and support community health centers that offer affordable healthcare service in underserved areas.
The system is a big it feels like a big juggernaut, and it won't actually move or meet the actual access needs of people with learning difficulties or learning disabilities.
People might know, obviously there have been people in the past that have Down syndrome that get DNRs put on them in hospital simply because they have Down syndrome, and the reason you wouldn't resuscitate them is because they have Down syndrome. So I think what COVID has shown is that we don't have consideration for people that can't speak out loudly.
These are just a few examples of unequal treatment due to discrimination. Discrimination itself has been an issue that plagues our community until now. But in the healthcare setting, it is even more problematic because healthcare is being compromised. People receive worse or lacking treatment and care simply because of who they are. They are dismissed, not given priority, treated unfairly, and shown a negative attitude. They are race, ethnicity, age, gender, religion, or disability. Discrimination in the healthcare setting creates an uncomfortable and unsafe environment and dampens the quality of service received and given. Thus, instead of getting better, patients may end up being worse. And instead of being able to work efficiently, healthcare workers may end up performing poorly or not being able or allowed to perform. Those in the minority are heavily affected, and this is not just limited to patients. Even healthcare workers themselves face discrimination. Because of the discrimination present in health settings, people are being excluded to fair and equal treatment. Thus, inclusivity will be a key aspect towards providing a healthy and safe environment, where patients and healthcare workers can be comfortable and feel safe and valued by one another. In return, this increases the performance of the hospital and the health of people. By encouraging inclusivity, patients wouldn't have to be fearful of getting medical treatment due to discrimination, and they would receive the appropriate care, while workers would be able to perform their job better without discomfort, and they would receive the appropriate incentive or reward and treatment from the hospital and its employees.